You might think the COVID-19 pandemic is behind us. The masks are off, the lockdowns are over, and life looks kind of normal again. But what if I told you things are not really back to normal? In fact, in a lot of strange and scary ways, we're still living in the aftermath of those lockdowns. Right now, the virus came and went like a storm, but the damage it left behind, that's still unfolding. Quietly, invisibly, but deeply. It changed our jobs, our schools, our minds, our relationships, even our bodies, and many of us don't even realize it. Let's start with something that affects almost everyone: prices. Inflation exploded after the pandemic. Some of it came from supply chain issues, sure, but lockdowns played a huge role. Whole industries froze, factories shut down, ships stopped moving, workers stayed home. And when the world tried to start back up, it wasn't smooth, it was chaotic. That chaos led to shortages, which led to higher prices. And here's the scary part: we're still paying for it. Rent is higher, groceries cost more. Everything from eggs to paper towels is more expensive than it was before COVID hit. And experts say some of those price jumps might never go back down. Lockdowns triggered a kind of economic ripple, and we're still feeling the waves. But money is just the beginning. Let's talk about mental health. Before the pandemic, anxiety and depression were already rising, but during lockdowns it exploded. Millions of people were stuck at home, isolated from family and friends, cut off from the world. Schools went remote, offices closed, streets went silent. That kind of isolation, it does something to the brain. For many people, it was like living in a pressure cooker. Anxiety skyrocketed, panic attacks, sleepless nights, feelings of doom. And after lockdowns ended, those feelings didn't just vanish. In fact, in a lot of cases, they got worse, especially for teenagers. One study found that teen girls in particular reported record levels of sadness after the pandemic. Suicidal thoughts, loneliness, social anxiety. Imagine being 13 or 14 and missing two of the most important years of your life, cut off from your peers, staring at a screen, trying to grow up in a virtual world. That's not just sad, that's dangerous. And here's what's even darker. Some kids never really re-entered society. Even now, thousands of students are still not going back to school. They dropped out, disconnected. Some disappeared completely from the system. And it's not just kids. Adults are feeling it too. Rates of alcohol abuse and drug overdoses shot up during lockdowns and stayed high. People lost routines, lost support systems, and many just never recovered. Let's not forget about work, because lockdowns didn't just shut down offices. They rewired the way we work. Remote jobs exploded. Sounds great, right? Work from home, wear pajamas all day. But here's the catch. For many people, work never really ends now. When your office is your bedroom and your computer is always nearby, the lines between work and life blur. Burnout became a silent epidemic. People started working longer hours than ever before because they couldn't disconnect. The world expected everyone to be constantly available. Emails at midnight, Zoom calls from the couch. It felt like freedom at first, but now for some, it feels like a trap. And then there's the labor shortage. During the lockdowns, millions lost their jobs. Some were laid off, others just quit. And when the economy opened back up, a lot of those people didn't come back. They left entire industries: retail, hospitality, healthcare. Many of them never returned to work at all. Some retired early, others shifted careers. The job market changed forever. That's why even now, years later, you walk into restaurants or stores and see "help wanted" signs everywhere. There just aren't enough workers. And the ones who are working, they're often overworked, underpaid, and burned out. Even the healthcare system, arguably the most critical thing during a pandemic, is still suffering. During lockdowns, hospitals were overwhelmed. Nurses and doctors were exhausted, traumatized, sometimes even harassed or attacked. Many quit. Others got sick themselves. Now in 2025, many hospitals are still short-staffed. Wait times are longer. Burnout is high, and many medical workers say they're still carrying the emotional scars from the worst days of COVID. Some talk about PTSD, about watching patients die alone, about not having enough equipment or support, That kind of trauma doesn't go away when the lockdown ends. And what about trust? Because during the pandemic, trust in institutions collapsed. People didn't know who to believe anymore. The government, the media, even doctors. Conflicting messages, changing guidelines, confusing data. It all added up to a growing sense of fear and doubt. That distrust hasn't faded. If anything, it's grown deeper. You can feel it in conversations and politics online. People are more suspicious, more divided, more angry. It's like the lockdown didn't just isolate us physically. It pulled us apart emotionally too. Even relationships weren't safe. Marriages broke under the pressure of lockdowns. Divorce rates spiked in some places. Domestic violence went up. Being trapped in a small space with someone, day after day, week after week, can reveal cracks you didn't know were there. On the flip side, some people who lived alone during lockdowns suffered in a totally different way. Imagine not speaking to another human being in person for weeks. No hugs, no handshakes, no casual conversations. That kind of loneliness can actually change your brain chemistry. Some scientists now believe we might be in the middle of a loneliness epidemic, and it all traces back to those months of forced isolation. Even sleep patterns were affected. You might have noticed it yourself. Trouble falling asleep, strange dreams, staying up too late. That's not random. Lockdowns messed with our routines. No commute, no fresh air, too much screen time. And over time, our internal clocks went haywire. And here's something truly creepy. Some researchers think our memory is different now. People report foggy thinking, trouble concentrating, forgetting things they used to remember easily. Part of that is stress. Part of it could be long COVID. But part of it might be the lockdown lifestyle itself. A brain deprived of stimulation, movement, and social interaction doesn't function the same. And speaking of long COVID, that's another layer. While the lockdowns were meant to slow the virus, they didn't stop it. Millions still got infected, and many of them are still sick, months, even years later. Chronic fatigue, brain fog, breathing problems, even in young, healthy people. That's why you see people in 2025 who say they haven't felt normal since 2020. Not because of lockdowns directly, but because the virus lingered. And lockdowns weren't a cure. They were a pause. But what about children? This is where it gets even more heartbreaking. Young kids who were supposed to be in preschool or kindergarten during lockdowns missed critical learning windows. Some are behind in speech, in reading, in social development. They didn't get to practice sharing toys, making friends, or just being around other kids. And for children with learning disabilities, the pandemic was a nightmare. Remote learning didn't work for them at all. Many are still playing catch-up. Some might never fully catch up. We won't know the true effects of that lost time for years, maybe decades. And yet somehow people keep saying the pandemic is over. But is it? When the ripple effects are still shaping our lives, our minds, our bodies, and our future? The deeper you look, the more you realize. The damage didn't stop when the world reopened. It just sank in quietly, changing us in ways we're only starting to understand. Let's talk about something that doesn't get nearly enough attention. Children born during the lockdown. You see, babies born in 2020 and 2021 entered a world where faces were covered, outings were rare, and interaction was minimal. These are the years when a child's brain is supposed to explode with development, learning language, emotion, eye contact, social cues. But during the lockdowns, many babies didn't see strangers' faces. They didn't go to parks. They didn't attend play dates. Some barely saw anyone outside their household for the first year of their life. And now, some studies are finding developmental delays in these kids. Delays in speech, delays in motor skills, even emotional differences. It's like an entire generation started life in a world that didn't give them what they needed to thrive. And there's no easy fix for that. Then there's the issue of technology. During lockdowns, screens became our lifeline. For school, for work, for socializing, for entertainment. But when screens became everything, something broke. Children especially became more hooked than ever before. And now many parents say they can't get their kids off devices. Screen addiction exploded. Attention spans shrank. TikTok, YouTube, video games. It all filled the gap left by real human connection. Even adults became more dependent on their phones and computers. Endless doom scrolling, binge watching for days, constant video calls. The line between real life and online life got blurred, and for many that line never came back. And it's not just about distraction, it's about what we lost. During lockdowns, we stopped going to concerts, sporting events, museums, religious gatherings, family reunions, all the things that make life rich and meaningful. And some people never returned to those things. They just stopped going. In some cases, people became socially anxious, afraid to be in crowds, nervous around others. For some, the lockdown rewired how they felt about public spaces entirely. That's not a small thing. That's a cultural shift. Even faith communities were changed. Churches, mosques, synagogues, they all went online. And when the doors reopened, some congregants never came back. Attendance dropped permanently in many places. Some religious leaders say it's the biggest shift in decades. Now let's move to another place lockdowns left their mark. Crime. During the pandemic, crime patterns changed in strange and scary ways. Domestic violence went up. Gun sales hit record highs. In some cities, murder rates spiked. Some of it had to do with desperation, some with stress, some with people being trapped in dangerous situations with no way out. And after lockdowns ended, crime didn't magically go back to normal. In some cities, it stayed high. In others, it shifted. More theft, more shoplifting, more carjackings, more social unrest. The system cracked under pressure, and parts of it never fully recovered. Even the legal system slowed down. Courts shut down or moved online. Trials were delayed for months, sometimes years. And that backlog? It's still being sorted out in some places. Justice delayed, sometimes justice denied. And there's something even more invisible, the effect on trust between people. Lockdowns made us suspicious of each other, of strangers, of neighbors. Remember when people would glare at each other for not wearing a mask, or yell in stores, or report their neighbors for having too many people over? That tension, it didn't disappear. It settled into the background of daily life. We started seeing others not just as people, but as threats. And over time, that kind of fear changes how a society functions. It makes us more isolated, more divided, less willing to help, to connect, to trust. And now, we're paying the price for that invisible wall we built between us. Now let's take it even further. The effects of lockdowns didn't just stop at people. They affected entire systems, like education, not just for kids, but for colleges and universities. Many students who started college in 2020 had a totally different experience. Online lectures, empty dorms, no social life, and a lot of them dropped out, or never enrolled in the first place. College enrollment plummeted during and after the pandemic. Some schools closed permanently. Others are still struggling to recover. And here's the terrifying long-term result. Fewer students mean fewer future workers in critical jobs, like teachers, engineers, nurses. It's a chain reaction. And it started with those first months of lockdown. Another huge system that broke? Healthcare. Not just the staffing crisis we talked about earlier, but the missed care. During lockdowns, millions of people skipped medical appointments, cancer screenings, heart checkups, dental work, mental health therapy. Some were afraid to go. Others couldn't get in. Some didn't want to bother the system. But the result? Diseases that went undetected, conditions that got worse. People who died, not from COVID, but from what went unnoticed during those months. We'll never know the full number, but it happened, and it's still happening. Even the way we grieve was changed by lockdowns. People lost loved ones and couldn't attend funerals, couldn't hug each other, couldn't say goodbye. That kind of grief, unprocessed, delayed, bottled up, can haunt people for years. It's one thing to lose someone. It's another to lose them in silence, alone. And what about global consequences? Lockdowns didn't just affect rich countries. In poorer nations, the impact was devastating. Lockdowns crushed local economies, families slipped into poverty overnight, schools shut down, sometimes permanently. Children were forced into labor or early marriage just to help their families survive. In some parts of the world, the scars of those months may last a generation. And now, maybe the most haunting part of all, we might do it again. Governments around the world saw what lockdowns could do. Some saw them as necessary, others saw them as tools of control. And now that the idea is out there that you can shut down society in a matter of days, It's become part of the playbook. That thought alone is chilling, because we know what it cost us the first time, and we're still counting the cost. So here we are, years after the lockdowns ended, still piecing together what we lost. It wasn't just jobs or money or school time, it was time itself. Time with family, time with friends, moments we'll never get back. For some, the lockdown was a blur. For others, it was a trauma. But for everyone, it was a turning point. The world didn't just pause in 2020, it changed. And even now, it hasn't gone back. Maybe it never will. If this opened your eyes to just how deep the impact of those lockdowns still goes, don't forget to like and hit that subscribe button. We dive into the stories that others skip, the quiet truths, the hidden effects, the things that still shape our lives today.